I formed the Colab for Community and Behavioral Health Policy, which is in the Department of Psychiatry and Behavioral Sciences at the University of Washington in about 2019 as a way to bring together different projects I was leading from different funding sources under one umbrella that clearly communicated our commitment to collaborative problem solving with real-world public systems and communities and partners. So everything that we do at Colab is a collaborative effort to address a public problem. Colab's work isn't possible without our community partners. We partner with about 100 different organizations and community advocates a year in all sorts of different efforts to improve public systems. Colab, we strongly believe that community members should have as much of a direct influence as possible on the public solutions that impact them. And so we work at that in both levels. We work with governments to make policy making more permeable to community voice when the government is leading the charge on a public solution. And we also work directly with community grassroots organizations, advocacy, and youth wellness zones to bring ideas from the community into government through advocacy and partnership.
We have a resident-led place-based initiative in Spokane, Washington. And so as part of that, our resident steering committee has said since 2018 that mental health for youth is a top priority. Youth wellness zones are geographic small spaces where youth are able to talk about their challenges with mental health and wellness and then be the leaders in designing solutions toward those. And so in the youth wellness zones, then partners wrap around those youth priorities and co-design with youth solutions. So we have 4 in Washington State. Ours is nested in a high school elective wellness set of classes. And so those youth are the ones that organize, lead, collaborate, and present to youth, to residents, and to other leaders in our community.
One of the things that we do is provide facilitation for participatory processes, and it's been a great honor to have partnered with Colab as a facilitator for one of their projects. King County Youth Prevention Project focused on mental health and engaged community leaders along with government leaders to co-design a process that developed some policies that could improve the well-being of young people in King County.
The work that UW Colab does in the cultural psychiatry space is extremely important because for many patients who struggle with psychiatric conditions, their cultural beliefs play a big role in the success of a treatment. For example, for some of my Asian American families at Asian Counseling Referral Service, the parents believe that their children's depression was due to lack of hard work or determination. By explaining the biological component to depression, the family is finally able to understand why, despite all the pushing and prodding, the kids were not able to snap out of depression.
The work that University of Washington Colab and Deconstructing the Mental Health System is currently doing is so important for our communities. In 2024, Deconstructing the Mental Health System partnered with Colab to develop and pilot the culturally responsive care training. And this training provides attendees with the foundational understanding of firstly how the history of systemic racism impacts care, such as the overdiagnosis of schizophrenia of Black and Brown people. And it walks people through how to navigate the crucial work in a way that's respectful and accepting of people, regardless of culture, race, language, or abilities. The well-being specialist would leave this training with an understanding of how to provide evidence-informed services while preserving cultural practices and traditions, and how that actually creates trust within communities.
We know in public health, right, that the things that influence health the most is the conditions where we live in. So social, economic, and environmental conditions. People who experience those conditions on a day-to-day are experts on those conditions. And so I think effective public health strategies and programs and policies really need to be rooted, right, on the daily realities and lived experience of the people that are experiencing the issues.
A lot of the work that Colab does actually really intersects well with the values that we have within the field of social work. We're very focused on community engagement. We're very focused on not just individual level changes, but also systemic level changes that can really impact behavioral health policy at a very higher level than at the individual level.
What we would really love for the future for Colab is to spread this exciting vision of community collaboration in public problem solving and to be part of a movement of many, many organizations and academic units and governments really embracing this spirit of collaboration and being a part of that.
Thanks for watching, but now an important disclaimer. The content of this video is not intended to be a substitute for professional medical advice, diagnosis, or treatment. Viewers should not disregard or delay in obtaining medical advice for any medical condition they may have and should seek the assistance of their healthcare professionals for any such conditions.